Well, I have to tell you that I have a couple of new CDs coming out here in a few weeks. And, of course, that's pretty typical of every year because there's so much information comes out every year that supports everything we say to do on a positive end and also supports our view that the medical system is a negative. And so we have to have a couple of new CDs every year, at least, and a DVD and some new books and whatnot. So a lot of new things coming. And it's one of the things people always ask me about is, why did you start Youngevity? Why did you do that? Well, I needed an army to get information out. When you know how to save over a 30-year period 1 million children, you have information to prevent and reverse a horrible disease in 1 million children over a 30-year period. Would you not do that? Well, this is what drove me to actually start the seeds of Youngevity. Over time, I've come up with Youngevity some 18 years ago now. And it all started in 1977. I want to start in 1977 when I made the discovery of the first non-human case of cystic fibrosis at the Yerkes Primate Center at Emory University in Atlanta, Georgia. I'd already done some 20,000 autopsies by then. My book, which came out of that 1,200-page book, was destined in 1983, 6 years later, to be a national treasure in the Smithsonian Institute, but I hadn't yet put all the book together, still collating all the data from 20,000 autopsies and 10 million chemistries and 10 million special stains, and looking for pollution as a contributing to deaths from natural causes. But I found out that every animal, every human being that died of a natural causes died of a nutritional deficiency. Well, ran into the first case of non-human cystic fibrosis. Cystic fibrosis, of course, is a terrible digestive and respiratory disease of kids, thought by the medical system, even yet today, to be a genetically transmitted disease. And I found out that by a little detective read, because I already done all these autopsies, I knew how to do it, knew how to backtrack, and found out that it turns out it was a feeding mistake with a whole colony of non-related animals, no blood relationship. And by biopsy, they all had cystic fibrosis too. So I had a whole colony with cystic fibrosis, so it was very easy to track it back and find out where the mistake was and find the cause, prevention, and cure for cystic fibrosis. Make a long story short, everybody was excited. All the experts said it was cystic fibrosis. Emory University made a news release. The National Science Foundation made a news release. National Institutes of Health made news releases. I mean, this was all over the place. And I was a hero for a couple of months. And then suddenly I said, well, I know what causes it. Now it's not genetic. And before I even got the words out of my mouth, they fired me. And looked around, tried to get another job so I could continue the work. And I did get a job at St. Louis University. And I'm unpacking my boxes in the office, and the dean of the medical school comes down and says, oh, sorry, Wallach, the National Institutes of Health said they're going to defund our federal grants if we hire you, so you're fired before you even get started. So that's when I went back to school and became a naturopathic physician so I could treat these kids. And I had the opportunity to go to China and Qishan province in 1989. There's a disease called Qishan disease, which is caused by a deficiency of selenium, cardiomyopathy of heart disease, sudden heart death in these kids. Large numbers, 3 out of every 1,000. And we're talking about a province in China that has almost a third of a billion people in it because they have 1.8 billion people in this very large province. And 3 out of every 1,000 kids die each year from, we're talking about tens of thousands, die from this Qishan disease, cardiomyopathy heart disease, which was a known deficiency of selenium. And I knew that one of the basic causes of cystic fibrosis was a selenium deficiency, which caused all kinds of problems with the pancreas and the liver. And then there was the piece that they thought was the genetic marker, which is a positive sweat test, the respiratory stuff, which is caused by another problem. And I had figured out how to reverse the genetic markers and how to get rid of the respiratory problems, the whole thing. Well, it did, to make a long story short, some 1,700 autopsies and 1,700 kids who had died of Qishan disease, selenium deficiency, and 35% of those, 595 of them had cystic fibrosis, and 100% had muscular dystrophy. Rolled it up, got it published, a well-respected, peer-reviewed, refereed journal of the Biological Trace Element Research Journal, and sent copies to the Cystic Fibrosis Foundation, Muscular Dystrophy Foundation, got no response. June of 2005, the International Laboratory Animal Research Journal, which is the official laboratory research journal for this National Science Foundation. I had been on their site business committee for about 5 years and worked with the National Science Foundation, so they knew me very well. And in there, that particular issue was just on research on primates. The government was defunding primate research, and they said, in the 20th century, one of the greatest pieces of research ever done was to find the non-human case of cystic fibrosis in a monkey. And then they went on to say, in brackets, Emory University refused to release the name of the young pathologist, me, Dr. Joel Wallach, who had made the discovery. Emory University, even in 2005, which they had a point there where they could fix the whole problem, said, no, we don't know who that guy was. They refused to release the name. Me. And so now we have the book Epigenetics, which goes into the whole story. I had always been reluctant to tell the whole story because I didn't want to name names and point fingers. But, it's time. So when you get the book Epigenetics, you're going to hear the whole story of cystic fibrosis, all the bad boys and all the bad girls, what they did to squash this information. They were willing to save their reputations by killing almost 1 million children over a 30-year period. Epigenetics, the death of the genetic theory of disease transmission. We'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk about a CNN story that I found that's headlined, Magnesium, an invisible deficiency that could be harming your health. Say, are you feeling exhausted, have weird muscle cramps? You might be suffering from a magnesium deficiency. They've dubbed it the invisible deficiency by some experts. They say it's so hard to spot and diagnose that magnesium deficiencies are more dangerous than you might think. They say magnesium is used in about 300 biochemical reactions, according to Dr. Daneen Frug, the American medical director at, she's the associate medical director at the Pritkin Longevity Center in Miami, Florida. She says that monitoring your magnesium intake can easily fall through the cracks. Studies have shown that only about 25% of U.S. adults are at or above the recommended daily amount of 310 to 320 milligrams for women and 400 to 420 for men. And they say an 05 to 06 National Health and Nutrition Examination survey revealed that at least half of the U.S. population had inadequate intakes of magnesium. She said, here's how to figure out whether you're not getting enough of this super nutrient. She says loss of appetite, nausea, fatigue are the initial symptoms of magnesium deficiency, and also says that it manifests in 3 different stages. Initially, symptoms can be minor. Magnesium deficiency may cause cramping and cause noticeable problems with your muscles and nerve function, such as tingling, cramping, numbness, contractions, and annoying eye twitch. And they say the worst stages, it could even cause seizures, personality changes, or abnormal heart rhythms. They say the condition can be difficult to detect with medical tests, since only 1% of magnesium is found in your blood. Most is in your bones and your organs. She goes on to say that diagnoses are usually made through a process of elimination by examining the patient's lifestyle. It may be what you're eating rather than what you're not eating. She said, I think the reason so many people are deficient is because a lot of food and drink can make magnesium unavailable in our bodies. Goes on to say main culprits are sodas, caffeinated beverages, and alcohol. If you love soft drinks, you'll be less likely to have adequate amounts of nutrients, including magnesium, in your diet. Gee, something you've been saying for years. And they go on to say drinking alcohol doesn't help. Consuming too much alcohol can interfere with your body's absorption of vitamin D, which aids in magnesium absorption. Refined sugar causes the body to excrete magnesium through the kidneys. And she said, so should you turn to food or supplement for your fix? Supplements will probably give you a boost, but it's best to focus on food. And that's I found it interesting that, once again, they want to cherry pick one nutrient rather than all 90 that you need for good health, because, not only do you need magnesium, you need magnesium. Magnesium helps you shuttle calcium around your body. So you got to have all 90, just like you've been saying for 40 years.
Well, you're exactly right, Doug. And, of course, the way to determine magnesium levels is with a hair analysis. In the book, Rare Earths Bin Cures, in Chapter 11, teach you how to collect a hair sample properly, what instruments to use so you don't get contamination from a steel scissors, and it tells you how to collect it, where to send it, and it teaches you how to read your own hair analysis properly so you can get some idea. And so that's where I would say, again, a blood sample isn't a very good way to determine magnesium, and sort of doctors throw up their arms, and the average person is not going to know all the questions asked, and so hair analysis is the way to do it, very economical. And again, the book Rare Earths Bin Cures, Chapter 11, tells you how to collect it, where to send it, and how to interpret it when you get the results back. And epigenetics, the death of the genetic theory of disease transmission, goes into many of the major diseases that you can get from having a magnesium deficiency. And of course, as I said, 300 different chemical reactions. A lot of stuff doctors are calling autoimmune and genetic are really just a magnesium deficiency. So thank you for bringing that one up, Doug. Again, epigenetics, the death of genetic theory of disease transmission, and rare earths, forbidden cures. And we'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
All right, let's head to Michigan. And Sherry, you're on with Dr. Wallach.
Oh, Sherry, you're on the air.
Hello, Dr. Wallach. Thank you for talking with me.
Yes, ma'am.
I am calling both for myself and mostly for my dog. I'm real concerned about her. She has been on enalapril for an enlarged heart, and she was.
Okay, how much does she weigh?
She weighs close to 14 pounds.
Okay, and how old is she?
She is 14, but she doesn't look it.
Okay, 14 pounds, 14 years old. Okay, I remember that. And what kind of heart problem does she have? She stays in an enlarged heart. Does she have congestive heart failure? Does she have cardiomyopathy heart disease? What does she got?
A heart murmur, an enlarged heart. You can hear it in the top of her back.
Mm-hmm.
In the beginning, she had some fluid in her lungs, but that's all cleared up. Her lungs sound really good as of yesterday. And he mentioned her heart's at 30, if that means anything, that it's not getting any worse.
Mm-hmm. We only have a short moment here, so I want to ask some critical questions. Does the dog have any itchy skin where it scratches itself or chews or licks in any particular place?
No.
Okay, good. And been on the same dog food since you had the dog for 14 years?
Yeah, she's on a Purina Pro Plan healthy weight maintenance. She has a sensitive stomach, and that's been working for her. I tried to...
I'm going to stop you there again because we got to get going here so we can maximize our proactive piece here for the dog. I got enough information. Char, we have a 14-pound dog here, and it's been getting the same dog food for 14 years, has an enlarged heart, and got a heart murmur, which could be, again, fluid in the lungs, which has had, could be congestive heart failure, could be cardiomyopathy heart disease. What would you give this little dog in addition to its dog food?
I'd give it the Arthrodex, but I'd also give it some selenium because an enlarged heart means a lack of selenium, right?
Okay, could be, absolutely. Hypertrophic cardiomyopathy heart disease and enlarged heart caused by selenium deficiency. So I'd give that dog 2 of our selenium capsules, one at breakfast, one at dinner time, just pop them down the dog's throat, rub her little throat, and let her swallow. What would you do in case it was congestive heart failure because of the fluid in the lungs? And congestive heart failure, we know, is caused by deficiency of a single vitamin, and cardiomyopathy heart disease is caused by a deficiency of a single mineral, which you already talked about. So where would you get that extra vitamin?
I give her the de-stress. That'll take care of that.
Perfect. De-stress. Yep, 2 of those a day, one again at breakfast, one at dinner time. And don't forget Arthrodex. I'd give her 1 full scoop of the Arthrodex in her food every day. And we'll be back after these messages.
Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Hello, Gottfried, you're on the air.
Dr. Wallach, thank you. Happy and prosperous New Year. Thank you for everything.
Thank you so much, and right back to you. A happy and prosperous New Year to you and all your friends.
Thank you. How can we help downline who is suffering from retinal detachment, glaucoma, and blind in the left eyes, please?
Okay, there's one person?
Yeah.
Okay. Glaucoma can certainly cause loss of vision. It can also contribute to a detached retina, which is it can be a combination of increased internal pressure inside the eye, and like high blood pressure inside the eye. High ocular pressure can also be caused by a unhealthy maintenance of the elastic fibers in the eye, which would hold the retina to to the globe of the eye, the sclera of the eye, the white sort of opaque material that makes up the globe of the eye. And so they have to work on all those things. How much does this person weigh, you think, Godfrey?
150 pounds.
Okay, thank you, sir. Yeah, well, I'd get rid of all the inflammatory stuff. Okay? Let's see if we can't help the vascular system here. Absolutely no fried foods. No processed meats with nitrates and nitrites. It means no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, brats, all that kind of stuff, right? Absolutely no oils. That means no olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, and no gluten, no wheat, barley, rye, and oats. All that's got to go. Get rid of all the inflammation. And then the 150 pounds, I'd have them take 2 of the healthy brain and heart packs per month. The brain is the eyes. The eyes are the brain. There'll be 3 of the Ultimate Selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Plus at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. All that will be accomplished by the 2 healthy brain and heart packs per month. Specifically for supporting healthy blood pressure and healthy ocular pressure, and having support for healthy blood flow through obstructed arteries in the brain, the eye, the heart, and the kidneys, I would have them take 3 of the Ultimate Daily tablets twice a day, 3 at breakfast, 3 at dinner. That'll be 1 bottle a month. And then call me every couple of weeks. Certainly, they have to continue using the drops that I'm sure that the eye doctors prescribe to keep the pressure down in the eye. But as the pressure begins to drop in the eye from this nutritional approach, the diet and the supplement program, the eye doctor, not the individual, but the eye doctor who can actually measure the pressure in the eye will determine when it's time to begin reducing the number of drops, say from 12 to 8, and then 8 to 6, and so on. And the eye doctor who actually measures the pressure in the eye will be the one to determine when it's safe to do that. And then every time they go to the doctor, they should give you the information. You call me and bring me up to date, and we'll walk this fellow through this. Merry Christmas, Happy New Year, Godfrey. And we'll be back with Jet Doctors on live for these messages.
Let's head to Oklahoma. And Randy, you're on with Dr. Wallach.
Well, Randy, you're on the air.
Hi.
Oh, you have to speak up. I can't hear you.
Can you hear me now?
That's much better. Thank you.
Okay, I'm a 58-year-old male, and I've got a polyp or a tumor in my descending colon, and I was going to call you to find out what you would think about that.
Okay, did they determine this was a polyp by an ultrasound, a colonoscopic exam, or what?
Biofeedback, bioresonance by a naturopathic doctor.
Mm-hmm. Okay. Well, what I would do, before you had anything more invasive done, I would get a high-resolution ultrasound. In fact, most radiology laboratories will give you an ultrasound. In many places, in the big malls, you can get those things done without a prescription. And I go and get a non-radiology, where you're not going to get any x-rays, get a high-resolution ultrasound and have them look at the colon and see if, in fact, you do have polyps in there. I actually like to see them as opposed to doing electronic stuff to figure that out. Some people are pretty artsy, craftsy about that, but myself, I like to see something on an ultrasound, no radiation. And usually when you have a polyp, of course, they're caused by chronic irritation, eating fried foods, eating processed meats with nitrates and nitrites, eating oxidized oils and salad dressings and cooking oils and salad dressings and that sort of stuff. I would also get rid of any inflammatory foods such as the gluten-containing grains, the wheat, barley, rye, and oats. If you have, do you have any symptoms that you went to this naturopathic doctor for? Do you have a constipation, diarrhea, any diagnosis of irritable bowel syndrome or colitis?
I had a colon rectal cancer back in '98, and I had a resection at that time. And so I've been watching myself the last 16 years.
Okay.
But, this just came back.
Yeah, I would get a high-resolution ultrasound, especially with a history of colon cancer. They did. How much of your colon did they remove?
About 5 inches.
Okay, so they didn't have to put a colostomy bag on you.
Right.
Okay, good. Yeah, I would get a high-resolution ultrasound. You can also go to if the naturopathic doctor did not do this, you could go to a pharmacy without a prescription and get one of these occult blood test strips. Or there's another one out, a new one out called a FIT test, which is an acronym for fecal immunochemical test. It'll tell you if you have any blood in your stool, which can tell you if you have any ulcerated or bleeding polyps or tumors in your colon. It costs you about $1.50. You can do that sort of stuff. But I would, again, get a high-resolution ultrasound and see if there is a polyp there or a return of the tumor. But after 16 years of being essentially cancer-free, I would assume that they got whatever was there, whether it was cancer or not, or it was a polyp or a non-cancerous polyp, or it was cancer. 16 years ago, they probably did a good job, whatever it was, and it's gone. But I would definitely go ahead and look. Okay, have somebody eyeball with a non-radiology thing. But you can do the occult blood test. You can do the FIT test yourself. Go to a pharmacy without a prescription. Go ahead and get those test strips. And then if you're not already taking the 90 essential nutrients, so what do you weigh, sir?
I'm 6'1", 190.
Okay. At 190 pounds, I would go ahead and take 2 of the healthy brain and heart packs. It seems kind of funny you're going to take the brain and heart pack when you have a colon problem. But that will allow you to have 3 of our Ultimate Selenium at breakfast and dinner, 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 EFA Pluses twice a day, 3 EFAs twice a day. All that will be accomplished by the 2 healthy brain and heart packs per month. I would throw in 3 of the Ocean's Gold tablets twice a day until we know any better. I'd throw in 3 of those twice a day. It'd be 2 bottles a month for the sea cucumber that's in there, just legendary for supporting your immune system when you have cancer. And then I would also take in what we call Z-Radical, which is a liquid. It's a blend of super juices, plus it has 50 milligrams per ounce of the fucoidan, which is, again, legendary source of immune support, which the Japanese in particular eats a lot of this red marine algae that has the fucoidan in it. And they have an extremely low rate of all cancers compared to Westerners who don't eat this stuff. And so I'd take at least 2, maybe 3 ounces a day, so it'd be 2 or 3 quarts of the Z-Radical, Z like zebra dash in the word radical. And again, clean up your diet, no fried foods, no processed meats, no oils, no gluten. And then call me after you've had the high-resolution ultrasound and or the occult blood test and the FIT test. Okay, Doug, we have time to start another one.
We certainly do. Let's head to Plymouth, New Hampshire. And Justin, you're on with Dr. Wallach.
Well, Justin, you're on the air. Yes, sir.
Hello, Dr. Wallach. This is Justin out in northern New Hampshire. And I've been a longevity associate now for about 6 months, and so is my wife. Recently, we just visited on a family trip with my mother and the rest of the family, my brother and sister, their kids. We went to a water park, an indoor water park, and as soon as we came home from that, we were, and we still are a little bit today, coughing up all kinds of green liquid, phlegm, constant coughing and runny nose, and it's just been a terrible, terrible time for us. And just wanted to know what it is, what you could be, what you think could be wrong, and what I can do to try to nip this in the bud.
Anytime you go to a public place and you're in water, it's hard to know whether they've kept the chlorine levels up, and which would kill flu bugs and bowel movement bugs. Little kids poop in the water and all that kind of stuff when you go to these water parks. And so I don't know how good their hygiene was, but it's even at the breakfast table in the restaurant or where kids play in the sandbox. There is one of those things where right now is on TV today that the flu is at epidemic proportions in the United States. In most states, the flu is at epidemic proportions, and little kids are getting a very high level, of course, because little kids don't practice hygiene like they're supposed to, and wash their hands 4 or 5 times a day, and kiss their little friends they've just met and all that kind of stuff. And so definitely you want to be sure, if you've been an associate for a while, taking the products for a while, I would definitely get everybody on the Envision Colloidal Silver. You go ahead and gargle with that. Put a dropper full in a couple ounces of water and gargle 2-3 times a day with the colloidal silver, which will kill just about everything. very gentle, even if you have a raw sore throat. It's not anything that's going to sting or cause any problems for little kids. Teach them how to gargle. They help kill bugs in their throat and upper respiratory system and nasal passages. But also get everybody, according to their body weight, the killer biotic, and also support the immune system and kill a few bugs from the inside, as well as the colloidal silver. Call me in a couple of weeks. Let me know how it all goes. I'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. And Doug, let's go to callers.
Well, let's head to Michigan. And Mike, you're on with Dr. Wallach.
Well, Mike, you're on the air.
Hello, Dr. Wallach. Good afternoon.
Thank you, sir. I can help you.
Yes, I have an 18-year-old nephew who just took a bad fall down a flight of stairs and landed on the side of his head, damaging skull bones, some face bones, and ear canal bones.
Okay.
He has symptoms of Bell's palsy in his face and issues with his ear, hearing. So they are sending him to get some additional information about that from a specialist. My question is using the CM cream on that type of an injury and anything else you could recommend.
And how much does this young fellow weigh, you think?
He's about 200, 6'4".
Okay. Yeah, well, what I would do is give him to the Healthy Bone and Joint Pack, give him all the raw materials to support and promote maintenance repair here, particularly the repair after having this impact fractures. Like you say, you can use the CM cream down in his ear with a Q-tip. I give him a half a teaspoon in each ear 3 or 4 times a day. So you want, in addition to having 2 Healthy Bone and Joint Packs, in that you're going to get the 2 bottles, 2 jars of the CM cream, but I also get an extra couple of jars because he's going to go through a lot of that. But also get him 3 bottles a month of the CM Plus capsules, because I want him to take 3 of those capsules 3 times a day. That's going to give him from the inside anti-inflammatory properties and analgesic properties, so it can reduce the discomfort as well as reduce swelling and so forth. And it's amazing, especially 18 years old, has great healing capacity. Given the right raw materials, he should heal very well. You want to get rid of that swelling and that 7th cranial nerve, which causes the Bell's palsy type of thing. And basically, by putting that CM cream down in the ear on that side and giving him the CM Plus capsules to deal with the swelling and inflammation from the inside, sometimes you see results very, very quickly. Sometimes it'll take a couple of months, but you should see and I would not, which I say, I would not have to submit to surgery and all that kind of stuff without giving a supplemental approach at least a month or so to see if you're going to see something happen. You should see something very dramatic happen in a positive way within 30 to 60 days with a supplement program, a nice young fellow like this. And so I really wouldn't submit to surgery right out of the chute, okay?
Okay. And would the trauma oil be useful in this instance as well?
Oh, sure. Yeah, you can actually mix some of the trauma oil with the CM cream in addition to putting it down in his ear. Wouldn't hurt to take a little dollop on the finger and put it behind the ear, because that's where the 7th cranial nerve comes out of the skull and then goes along the side of the face. And, of course, when it gets traumatized, pinched, either by swelling or by a fracture or whatever, and it takes a while to kind of re-architecture everything back to normal, that side of the face will droop. And so, again, I think that is probably, which I say, you can get relief without surgery, and so it's worth a try, unless there's been a complete cutting of that 7th cranial nerve. If the 7th cranial nerve is cut in half, then it's going to take a microsurgeon to repair that nerve by sewing the 2 pieces together. But unless that's the case, you can tell that from a high-resolution ultrasound without the need for surgery to look. You can even do some nerve transmission stuff to see if that nerve has been cut in half. As long as it's not cut in half, that would require some surgery if the nerve was cut in half by a microsurgeon. Other than that, I don't think he'll need surgery, okay?
Okay, thank you very much, Doc. I appreciate everything you do.
Okay, thank you. God bless you. And let us know how this young fellow does, okay?
Absolutely.
Okay. Well, thank thank you, everybody. Really a great testimonies and questions today. Thank you so much, Char. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.